Hi all. Test your knowledge on Streptococcus with this MCQ. Challenge yourself on key concepts about this gram-positive cocci and its role in infections. This quiz covers Streptococcus classification, hemolysis patterns, virulence factors and pathogenesis, laboratory identification and biochemical test. Like, share and subscribe for more microbiology quizzes and turn on notifications to stay updated. The first question is, the following test is used to differentiate Streptococcus from Staphylococcus. So among these options, which test is used to differentiate Streptococcus from Staphylococcus? The options are coagulase test, catalase test, phosphatase test or indol test. And the answer is, it is catalase test. So you can see Staphylococci are arranged in clusters, grape-like clusters, whereas Streptococci are arranged in chains. And they can be differentiated by the test, catalase test, in which Staphylococcus gives positive result and Streptococcus negative. That is, in catalase test, on addition of hydrogen peroxide, there will be effervescence or bubble formation in the case of Staphylococcus, whereas in Streptococcus, it will be negative. So we can differentiate the gram-positive cocci with this catalase test as Staphylococcus or Streptococcus. So the answer is catalase test. The second question is, Quell-Lung reaction is due to the swelling of what? Quell-Lung reaction is due to the swelling of what? The options are capsular swelling, flagellar swelling, RBC or ribosomal swelling. And the answer is capsular swelling, because when antiserum, specific antiserum is added, there will be swelling of the capsule. So before addition of antiserum, there will be capsule like this, but after addition of antiserum, there will be a swollen capsule which can be observed like this. So it occurs as a result of capsular swelling. This test is called as Quell-Lung reaction. Next question is, alpha hemolytic streptococci are also known as what? Streptococcus pyogenes, virulence group, viridans group or cones. So first you have to know what is alpha hemolytic. So in blood agar, the colonies of bacteria can show three types of hemolysis, that is alpha hemolysis, beta hemolysis or gamma hemolysis. Alpha hemolysis is a partial discoloration which gives a greenish coloration, whereas beta hemolysis, it is a clear transparent zone surrounding the colonies, and gamma hemolysis, it is non-hemolytic. So among streptococci, alpha hemolytic streptococci are also known as which of these? Streptococcus pyogenes, virulence group, viridans group or cones? And the answer is, it is viridans group. So you can see streptococci are classified into alpha hemolytic, beta hemolytic or gamma hemolytic. Alpha hemolytic means they show greenish discoloration due to partial hemolysis, and the groups coming under alpha hemolytic streptococci are Streptococcus pneumoniae or commonly called as pneumococci, whereas viridans group of streptococci also are alpha hemolytic, in which Streptococcus mutans and Streptococcus sanguis are included. And the beta hemolytic group, as you can see, clear transparent zone surrounding the colonies due to complete hemolysis. Streptococcus pyogenes and Streptococcus agalactiae are included under beta hemolytic streptococci. And gamma hemolytic, as it is no hemolysis, it is Enterococcus. And the species included under Enterococcus are Enterococcus faecalis and Enterococcus faecium. The next question is, streptolysin O is inactivated by which of these? Is it carbon dioxide, nitrogen, oxygen or serum? So streptolysin O, it is an antigen produced from streptococci and it is responsible for hemolysis, so it is hemolysin. So the answer is streptolysin O is inactivated by oxygen. It is hemolysin which is inactivated by oxidation and it causes rheumatic fever. Whereas streptolysin S is another antigen which is oxygen stable and it is not activated by oxidation. Next question is Streptococci causing dental caries. Is it Streptococcus pyogenes, Streptococcus mutans, Streptococcus pneumoniae or Streptococcus bovis? So this is a dental caries. So this is caused by which of these Streptococcus species? Is it Streptococcus pyogenes, Streptococcus mutans, Streptococcus pneumoniae or Streptococcus bovis? And the answer is Streptococcus mutans. It causes dental caries. Whereas Streptococcus pyogenes, it is responsible for pharyngitis or Streptococcus throat infection, tonsil inflammation, swollen lymph nodes, fever, headache, etc. It can also cause scarlet fever, which occur as rashes on the chest or limbs and strawberry tongue. Pyoderma, that is conditions on the skin like pustules and crust formation, which is common in children. And erysipelas, which is raised red lesions on the face or legs. Pain, fever with chills, and it is common in children and elderly people. These are all caused by Streptococcus pyogenes, and Streptococcus pneumoniae causes pneumonia. It is one of the most common cause of community acquired pneumonia. And Streptococcus bovis, it is responsible for colorectal disorders or colorectal cancer. It is a natural inhabitant in human or animal gastrointestinal tract. It is an opportunistic pathogen. So that is about Streptococci. Thank you.